Gentleman from New York, Mr. Weiner.
Thank you very much, Madam Chair. You know, to some degree, this debate back and forth is utterly predictable. When we in Congress passed the Medicare Act and the Social Security Act, we heard the exact same objections from our colleagues on the other side of the aisle. I can tell you this. If we do this right and we pass this bill, all Americans, even the very well-to-do, are going to pay less. They're going to pay less, and I'll tell you how I know that. Because right now we are spending $1.2 trillion a year on insurance and for out-of-pocket for people who don't have insurance. That's not even counting what we're paying in additional taxes to provide care for the uninsured, which in New York City alone is $3 billion a year. You know, everyone says, oh, well, you're going to provide more taxes, you're going to strangle the economy. What's happening now? Do you not think we can get a 10% reduction in those costs? If you do, you know how much that adds up to? It adds up to $1 trillion over 10 years. And then I hear my colleagues complain about government-sponsored health care. You know what? I am half tempted to offer an amendment to eliminate Medicare. Then what would you do? What do you think Medicare is? It's government-sponsored health care, and it's one of the most popular programs around. Now, it's got problems, and we should fix it. But all of the concern, well, the public option is going to crush private insurance. Do you think consumers are not smart enough to choose the best one? And if they choose the public option, doesn't that tell you something? Are your constituents only smart enough to vote for you, but they're not smart enough to pick a health care plan for themselves? I think they're pretty smart. So let's set up a competitive model and see what works. You know, all of this has me thinking, what's the good of the private option? What is that doing? What is private insurance company? Name a single thing a private insurance company does to make anyone healthier, to save anyone money. Health insurance companies operate like they're supposed to. They're businesses. They operate to make profits. How do you make profits? By giving away as little and collecting as much. It's the opposite of the imperative that we have as the representatives of the people. But this is so utterly predictable because you didn't vote for Medicare. Your party didn't vote for Social Security. You said, let's just hold. You had control of the House, the Senate, the judiciary, the presidency for 8 years, and you didn't do anything. Except, no, I shouldn't say that. You passed Medicare Part D, which said, let's see if the private insurance, if we give them enough money, whether they'll do the right thing. Donut hole, anyone? You know, this is like Jabberwocky, which was the language spoken in Alice in Wonderland. Isn't that right, Ms. Baldwin? Through the looking glass. You know, if you say these words enough, sooner or later they take on a little life of their own. Well, you can feel free to do that, but the American people know you're standing in defense of a system that everyone knows is broken, everyone knows is too expensive, everyone knows doesn't work, and we were elected to change that. I yield back.